Welcome to SkinCast, the podcast where we dive deep into the world of aesthetics. SkinCast is proudly brought to you by Ceraderm, a leading distributor of advanced aesthetic solutions. At Ceraderm, we're committed to empowering aesthetic professionals with the tools and knowledge they need for a successful practice. Each episode will bring you expert interviews, success stories, and practical guidance to help you maximize your ROI, achieve the best clinical outcomes, and keep you informed about the latest innovations. So sit back, relax, and get ready to unlock your practice with SkinCast.
Hi everyone, I'm joined here by the wonderful Dr. Donna Freeman, who I would consider is a good friend of mine, and we've had some good adventures in the past, travelling the world, lecturing on lasers and different devices.
Yeah,
perhaps you just do an introduction. Tell us a bit about yourself.
Yeah, okay. So I've been in the laser industry or the energy-based device industry for 26 years now. Actually pulled into the industry by this very gentleman here, who diverted me from a path of pure colloid and polymer chemistry and dragged me into this industry, and I've never looked back. I'm very, very glad that I made it here. I have been involved in clinical education, clinical hands-on training with devices, and also then a lot on study work. So a lot of my background is on study work.
You've written some great white papers, and today we are going to be talking about this new device, Acryos, which is new to the UK. So I know it's a device we've chatted about, and I know we're both excited because we see some great parallels of work that we've been able, other products we've worked with in the past, and this seems to be a combination of them. So I guess the first question is, in a brief summary, what is Acryos?
So Acryos basically is it's a device that is fat cell targeting and skin cell regeneration targeting. So you've got the opportunity to do body shaping, but also what I think is really exciting about the device is you've got the opportunity to target cellulite. Not just one aspect of cellulite, which is, I think, the downfall of some of the products that have been out there on the market up till now, but you can target all of the factors that make up cellulite with this device. So it's really exciting.
Yeah, and I know that our past history, we've been involved in a number of different products, and a lot of them have just fallen short when it comes to cellulite. We both looked at this and said, wow, this is exciting for fat reduction.
Yeah,
reasons you'll come on to in a minute. But I think what's unique about it, and you'll, I guess, explain it, is how it can target cellulite and why we're so excited about this. So I guess the next thing is perhaps briefly talk about some of the scientific principles behind it. What sort of technology it's
yeah, I mean, it's an amalgamation of a lot of different proven technologies. That's what is exciting about it, because it can address all the different factors. So you've got in there, you've got your hypothermia for treating fat cells, which will create fat cell death, and then you've got your hyperthermia, which we know in the laser and light world, it can help to rejuvenate tissue. And what we have is also low-level laser therapy in there, which is causing biostimulation of the cells within the tissue, as well as electroporation therapy, muscle stimulation. So it's got an amalgamation of all of these different technologies that means that we can reduce down the sizes of fat cells. We can actually, through one of the principles, the heat shock principle, we can actually change white fat cells containing the adipose tissue, the thing we traditionally think of as being the fat cells. We can change those into brown fat cells, which are your more metabolically active fat cells, which means that overall an area of tissue can actually be burning up energy better. And then through the low-level light therapy and the muscle stimulation, we can just be rejuvenating tissue. So it's an amalgamation of a lot of different technologies.
I know that we've, and you wrote a paper with, I think my wife was involved in the study where you looked at low-level laser therapy for fat reduction. And I guess one of the problems, and you see systems on the marketplace that are pure low-level laser therapy, we both know that works, but the problem was people had to exercise afterwards. So I guess what's different about this, and why are we so excited? Why this is so different for if we address body shaping to begin?
Yeah, absolutely. So just for those that don't know, low-level laser therapy, if you use wavelengths around the 658 nanometers and also around about 850 nanometers, those particular wavelengths of light are very specific to absorbing into the mitochondria in cells. And by stimulating the electron transport chain within those mitochondria, they can actually stimulate the cell to do what the cell does naturally, but to do it very well, to enhance it. So when we put that sort of low-level laser therapy onto fat cells, we can get the fat cell to break down the triglycerides that it's storing inside, which is giving us, unfortunately, the excessive waste line. And we can get those the triglycerides to break down into free fatty acids and glycerol and to be released from the cell naturally. That's what the cell does day in, day out, if it needs to take energy in or if it needs to release energy to be burnt off. So on its own, low-level laser therapy can get the fat out of the fat cell and into a usable metabolic form, but there needs to be an energy demand on the body, and that was always what was missing in the past when we were working.
Yeah, well, I remember, I think we were partly when the discussion when I think Emma had a client come in that would always get a great 2 to 4 centimetre reduction every treatment.
Absolutely.
And then she'd put it back on again. And I can remember that Friday when we went out to lunch, and we wouldn't mention the person's name because she lives in my village, but she was eating a pie chips with gravy immediately after treatment.
Absolutely. That was her treat, wasn't it? After each of her treatments, she was going out and giving herself a treat because she'd had such an amazing response to the laser.
With the regime and that type of treatment, obviously relied on you go into the gym and exercise afterwards. So I guess what's exciting about this, am I right in saying, is that it's the combination of the shock of the constant cold and heating that immediately burns up the fat in. So is that what gives us the edge? Yeah,
basically. So some people might have heard of something called contrast lipolysis, which has been a sort of phrase that's been on the market up till now. But this, we're talking about heat shock here. We're branding it as heat shock therapy. Basically, when you put the body through alternating periods of time at either excessive heat and then excessive cold, the body has to respond to that, and it desperately tries to respond to that by vasoconstriction and vasodilation to try to either get rid of excess heat or to hold in heat if it's feeling extraordinarily cold. And to get the dilation and constriction, we've got to have muscular action, so we're actually putting a demand for energy on the body right at the very place where we're treating.
Perfect. So I think it's the perfect solution then, you know. And I guess what some of the viewers will want to know and what we're really excited about is the treatment of cellulite. So perhaps you could explain the whole process. Why are we so excited, and why are you so excited when you saw the data and said, I want to get involved in this? Like, why is it the breakthrough for cellulite?
Yeah, absolutely. So cellulite is a really complex disease, unfortunately. It's got a lot of little factors in it, and they all kind of go around in a vicious circle, getting worse and worse and worse if you don't manage to break the cycle. So you get, unfortunately, people tend to, they put on a bit of weight, the fat cells in a certain area start to get enlarged. As a result of them getting enlarged, they start to sort of swell, obviously, and start to put pressure on the surrounding blood vessels and lymphatic drainage. So we start to see less lymphatic drainage, which means you're not getting rid of the bad things from the body, the bad metabolic outputs and the toxins, and you're not able to get brand new nutrients into an area and brand new oxygen into an area. As a result of that, the tissue degrades, and so we start to see the fibrous septae holding the skin layers together start to degrade. They become very inflexible, and so they hold things down while
so
the fat cells, cells are increasing, septae are holding it all down, and that's why we get the dimpling on the surface of the skin. Now, where this I think is going to be phenomenal for cellulite is because we are going to be targeting the fat cells. So we're going to be helping there with the heat shock effect that we're getting, with the vasoconstriction, vasodilation. We are going to be getting skin cell regeneration. So we're going to be getting brand new skin tissue being formed. And we're just going to be seeing with the low-level laser therapy as well, the opening up of the pores of the cells to allow new nutrients and new oxygen to come into there, and enhanced lymphatic drainage to get rid of, flush out those toxins that are also staying stagnant within the area. So it's addressing all the aspects, whereas before a lot of the cellulite devices sort of address one aspect but can't really adapt on the others. This is really having a go at addressing all of them. So I think it's going to become the gold standard.
I know we were excited, and perhaps people will see on the screen now technology should allow us to show some before and after photographs while we're talking. We were quite excited about that.
Yeah, absolutely.
So I guess the other thing that people will want to know is it safe, and can we use it on all skin types?
Yeah, absolutely. So the heat and the cold, that can be used on all skin types. Low-level laser therapy is very much, it's different to normal traditional laser therapy that people perhaps are used to hearing about, tattoo removal, hair removal, that sort of thing, skin resurfacing. So the low-level laser therapy is such low doses, real biostimulatory doses, that again, it tends to be colorblind in terms of the melanin content of the skin. So we can treat all skin types with it.
You can treat all skin types.
Yeah, absolutely.
I know one of the other features is electroporation. I know we've used that in the past because that will allow us to put, I guess, products on to be able to enhance the result as well.
This is it. Yeah, this is it. We can start to, the electroporation is going to help us to get, in general, good tissue penetration of any products and good cellular penetration of those products as well. With the low-level laser therapy and the electroporation together, we've got the cells within the treatment area are open up and receptive to letting things pass back and forth across the cell membrane. So we can get those cells in that area as healthy as possible.
And I guess I know I saw one of the photographs from one of the clients you treated, who happens to work with us, Natalie, and that was just after one treatment. That showed a really significant result. So what would you expect would be the typical course of treatments? So
I think, you have to accept with anything to do with sort of body shaping and cellulite and tissue regeneration, it is multiple treatments. So it wouldn't be unreasonable to expect a sort of course of 6 to 10 treatments with most patients, I think, probably getting the best outcome to meet their expectations towards the 10 sessions.
So, I guess 6 to 10 treatments. How long does a session take, and what's involved?
Yeah, so actually a session takes around about 60 minutes, but for the clinic and for the therapist, for the practitioner who's using the device, it's actually very hands-off. So they literally just have to come in, get the patient settled, get the pads on the chosen treatment area, set the device up, and then those practitioners can actually be off doing other things during that time. They don't have to stand there with that patient. The patient can crack on with doing their work emails, etc., or watching a video, watching a podcast.
I'd hope they'd be using some of other devices to make
you
more money.
You never know, you could be doing that. You could be getting your toxins in, couldn't you, at the same time? But yeah, it is very hands-off for the clinic, so I think that's a really big advantage as well. A lot of the old technology that tried to address cellulite was these real sort of deep manual massage devices using great big bulky handpieces for an hour at a time. Nobody wants to be doing that.
No. So I guess from a return on investment point of view, people can sell courses of treatment. It's really, I guess, 15 minutes realistically for the therapist or the nurse.
Yeah, there's no reason why they couldn't have a whole sequence of patients they're setting up on this.
To set it up.
Yeah.
So I guess there's no consumable costs.
No consumables either, which is a huge factor nowadays. Absolutely. So I mean, there is no reason why the return on investment wouldn't be. Well, it'd be as fast as you can get patients in the door and treated.
Yeah, and I guess so. When you've got no consumable costs, people can pick the price. I always say to people, you have to look at your hourly cost, what you want to make per hour in every room, and that should be your cost.
Yeah, absolutely.
So with these sort of results, I guess people are looking pretty fast return on investment.
Yeah, and you can be flexible to meet the needs of your demographics. We can't. We know that London prices are going to be very, very different to some of the prices you might see in the Midlands or up north. So
you'd have to charge less in Swansea.
Well, very probably. Especially if they're going out to get pie and chips afterwards.
Yeah. And we won't talk rugby because it's been a bad.
Let's just not even go there at all.
But that's great. Thank you very much for today.
No worries.
I know I'm really excited on that next podcast because we're also going to be looking at other treatments and things like acne.
Fantastic. So, look forward to it. Thank you.
So make sure you all subscribe, follow us, and see you all again soon.